Hi everyone, I'm Stephanie. I'm with 9 Health. May is Mental Health Awareness Month, so for the whole month of May we've been focusing on different mental health topics and resources in Colorado, kind of connecting you to some experts and different resources that you can tap into. Last week we talked about mental health resources for teens and young adults. It was some great information. You'll find that on our Facebook page and also on our blog at 9healthfair.org, so you can check that out if you missed it. But today we're talking about mindfulness, what it is, how it helps your mental well-being. I'm joined by Christopher Meyer. Did I say it Meyer? I never even asked you. Meyer. Say I never even asked. Christopher Meyer, and he is a licensed counselor, and he's also a volunteer with Spark the Change. So you see all this Spark the Change stuff around us. Spark the Change has a pro bono mental health program, if I can get it out. They use volunteers to connect people in need of mental health services with, experts and people that need those services, making it kind of easier for them to access that care. And you're a volunteer with Spark the Change, so just let's start with what you do for Spark the Change and how you got involved as a volunteer.
Sure. I had done pro bono mental health, which is I'm in private practice, and I would donate 1 hour of my week to see someone without any charge. And it would bring in a diversity of people who otherwise couldn't afford to come to see a therapist. And I just loved the sense of fulfillment, and often there was a very willingness, and people went, wow, this guy's donating his time. And so it was very fulfilling. And I encourage any other licensed therapists out there to maybe consider whether you can get 1 hour of your week out of your schedule and give it to seeing someone who can't afford therapy.
Right, and not just even not affording it, but mental health resources are hard to come by in our state.
Yes, right.
So just being able to provide that to the community is a great
good.
service.
Yeah.
And your private practice is called Whole Story?
Whole Story,
And you do private counseling and life coaching for people and therapy services?
Yeah.
Okay,
Yeah.
So we're talking about mindfulness. Tell us exactly, people might think they know what that is, and we've talked about mindfulness before with 9 Health. We do a Monday Mindful Minute on our Facebook page, but tell us what mindfulness is.
Sure. I would say mindfulness are both certain actions that come out of a certain attitude. The actions are usually called practices, meaning you say, oh, let me do this, let me practice this. So there's something deliberate about them. The attitude, though, I think is more important even than the action. And what's the attitude? The attitude is, I'm going to pay attention whether I like it or not. I'm just going to pay attention to see what's so. The attitude is approaching your life with description rather than evaluation. My favorite two definitions of mindfulness is one, John Kabat-Zinn, who founded mindfulness-based stress reduction like 40 years ago, or almost 40 years ago, said mindfulness is paying attention in a certain way, in the moment, on purpose, non-judgmentally. And the non-judgmentally is the part that's hardest. Right. And people then start mindfulness practice by judging themselves for how judgmental they are.
Am I doing this right?
and it's a hard loop until you realize even not judging your judgingness is one way to get in.
Right. Yeah,
and then the other definition, and then I'll let you have another question. So the other definition is by a guy named David Richo, who's got a book, How to Be an Adult in Relationships, a book everyone should read.
Right.
But he says mindfulness is achieved when reality takes precedence over the ego. And I notice when I'm doing couples therapy sometimes, that all of a sudden the defensiveness will stop. And they'll kind of go, I don't really know why my wife is this angry, and I guess I'd like to know. And so they turn in more to find out what reality is, rather than who's right, who's wrong, who's to blame, but can't she see that, and just where this sense of, I just want to know what's the truth. And I would say that overlaps with mental health, because mental health is loving to be in relationship with as much reality as you can stand.
So if someone is suffering from a mental health issue, how do you kind of get them to be in that mindful state? Like I just feel like it might be hard for someone who is really struggling to just take a moment and try to really focus inward and do a mindfulness practice.
Right.
How do you lead someone through that?
Quite often by breath and body scans. And the most unfortunate thing about the word mindfulness is the word mind. I think full is very important. It's a very full experience. But mind is very confusing. All the languages where it gets translated from, Chinese, Tibetan, and all, the word for mind, they point to their heart. When they talk about their mind, they point here. This is my mind. And so heartfulness or even bodyfulness would probably be better words for it.
Right.
So most of the time, all we are is in this narrative script that we're completely identified with. And so people think, I am very full, and I'm full with my mind, so isn't that mindfulness? But
There's a lot happening in there.
There's a lot happening. There's a
Right.
lot of noise in there. So dropping and saying, how are your feet right now? Can you compare your left foot and your right foot? Can you say which one you're more in than the other?
Yeah.
Can you feel your seat? Can you trust the chair to support you right now? Can you actually feel your muscles relax a little bit as you turn over and go, oh yeah, I can let this chair support me. So any questions where you have to get the answer from the present moment means you can't have an answer from before. You have to answer in this moment. The body can never leave the present moment. The mind spends most of its time planning what did happen, rehearsing what it should have happened done there, but the body's always here. So the easiest way is anything about your body, like your breath, will bring you a little bit into, oh, I guess I can tolerate this moment. I sure can.
Bring you out of your mind.
And bring you out of your mind, right. Or bring you out of that obsessive racing, I've got to fix it by thinking.
The wheel.
The wheel, yeah.
The wheel's turning kind of thing. Yeah, it's very interesting. So again, if you're just joining us, we're with Christopher Meyer, and he is with Whole Story, which is his private practice, but he's also a volunteer with Spark the Change, which has a pro bono mental health program. I keep wanting to say pro bono mental health awareness program. We're talking about Mental Health Awareness Month, and let's just keep going. We're talking about mindfulness. You talk about the 4 R's. So when I was kind of setting this up with you, you'd put in your descriptions of things, the 4 R's. What are those?
Well, since we normally are locked into what we were talking about, the chattering mind, anybody who wants to teach you mindfulness is going to have to tell you some instructions on how to deal with thinking. So one practice that's called centering prayer comes out of a Christian contemplative tradition, but they have some brilliant techniques for dealing with mindfulness, and they have 4 R's about dealing with thoughts. They say reject no thought, retain no thought, react to no thought. Those are the 3 R's. And the 4th one is they say return. You could return to the breath, or they give a word, like a 1 or 2 syllable word. So if you just want to say let be as your 2 syllable word, so that whenever you feel, oh, where was I? Oh, I was out of the room, I was off somewhere, then you just go let be, and that brings you back.
So that's if you're in a mindfulness practice and you find...
If you say, I just need to take a break, you don't try to stop your thoughts. Because a lot of people think what meditation is stopping my thoughts, and, well, that was terrible because I didn't stop my thoughts. Well, the point is not to stop your thoughts. The point is neither to reject them, nor to get locked into them and let them retain you, nor to even react like, oh, that was a great thought, well, that was a bad thought. But none of those 3 positions, but instead return to presence. Return just to, oh, here we are. My foot still hurts. I still don't know what to do about it. I'm just a little bit less pissed right now.
So you talked about meditation. Is mindfulness meditation?
It's a great question. So I would say mindfulness is the all and all approach. You could say the all and all operating system to come at it, which is I am willing to be with whatever's here. I see is the, and then a formal practice of it. One of them would be meditation, particularly sitting meditation, what most people think. But I will do walking down the hallway to use the restroom or use the microwave or do that. I use that just as getting back in my body and do nothing but walk down the hall when I walk down the hall. So I'm doing a mindfulness practice, but a lot of people wouldn't say, well, that's not meditation. You're just walking to the lounge to heating up something. So yeah, meditation is just one more formal subset of the attitude of mindfulness and practice of it.
Okay. And if anyone out there has questions on Facebook, you can post those, and Kat, who's behind the camera, will ask them of Chris and I, and we will get them answered. Well, let's continue. So mindfulness, if someone came into your office and they're dealing with depression, anxiety, would you lead them through a mindfulness practice? How would mindfulness be used to help someone like that?
The main thing would be to quiet some of the white noise in the system. That's usually, most people come in and are very disturbed, even embarrassed. I don't even sometimes like the word mental health because it makes it feel like something must be going wrong with you. You're ill, you're broken, or something like that.
Yeah, that's true.
But when people come in to quiet the noise in the system, like there's something called the 4-7-8 breath. You breathe in for 4 counts, you hold it for 7, you let it out for 8. It's a yogic breathing. But if you do even 4 of those, because the out-breath triggers the parasympathetic nervous system and the in-breath triggers the sympathetic, the fight-flight, just by having a long, slower out-breath, you sort of quieted down how much white noise. And I know in communication things, there's something called the signal-noise ratio. So the more you lower the noise in a system, the more the quieter signals you can hear. And when people get quieter, they'll say something like, I've been angry all my life. And then they'll pause and they'll go, not all my life. You know, when I did gymnastics, I would just laugh and I think, how did they said one thing and then they corrected themselves.
Right.
What happened just then? Well, there was a study at the University of Chicago. The people who get the most out of therapy are ones who do just that. They'll hear something and they'll think, no, that's actually not the whole truth, and they'll correct it. What happened was they got quiet enough that they heard a little quieter voice going, saying, that's not always true. You're also this. And so listening to those quieter voices, I'd say, is step one. And then step two would be, so let's hear what those voices are saying, especially the ones that you don't want to have anything to do with, that are embarrassing. Do you call, oh, that's my selfish, oh, I'm needy. And you just want to dismiss that part of yourself. I'd say, oh, well, I'm interested in the needy part. What would the needy part have to say now? Well, she says, I'm never going to be loved. Oh, really? Oh, I'm glad to meet her. She's welcome to talk to us. And then we get into whatever old maps of who you are, what love is, how life is, what money is, whatever maps you have that no longer work for you. But it starts with quieting the system.
Interesting. So we've kind of talked about this. My next question was, how do you help people apply mindfulness?
Yeah.
We've kind of talked about some of it, but people might just be joining us as well. But how do you help anyone, really? Maybe they're not dealing with depression, anxiety, but they just need a minute, or they just are dealing with a stressful day. How do you help anyone kind of apply mindfulness?
I would say, like as instant, we make up a list and you can put it on your phone or something like that, which is ways to resource yourself. And we can make them into ways that ground you, ways that quiet your body. Like when you come in the door, kick off your shoes, walking around your bare feet, and if you like the feeling of just your feet touching the ground and you tune into that, you're using mindfulness to kind of feel stabilized, feel in touch with it. If cooking root vegetables or replanting a plant just quiets your mind and gets you simply there, you are then doing at home what we did in the session, which is starting to get more access to more parts of yourself. Breathing exercise, my 4 points of hygiene would be breathing, exercise, structuring your time, and minding your mind. Now, minding your mind is what most people think of mindfulness, like noticing
where your thoughts are going?
Like noticing I'm ruminating. Once again, I'm going over that last breakup I had, and I'm once again going, is what he said true, or whatever like that. And you think, wow, I am just circling through that. Most people don't even know that they're there. They're so lost in the thought, and if mindfulness made them go, oh, there I am, I'm catastrophizing, and I'm getting myself more anxious again by running this. Mindfulness is choicefulness. And if you all of a sudden notice you have a choice to not stay in that conversation, wow, that's freedom.
Yeah, very interesting. And if someone, well, let's see, I did want to ask you, just to describe, we talked about breathing, and you mentioned 4-7-8, right? So breathe in for 4, hold it for 7, let it out for 8, and do it 4 times?
You start with 4 and you work up to 8, and that'll take you maybe 5 minutes of your life.
And it's a simple exercise for anyone to do.
Very right, yeah.
Just kind of bring you back to wherever you need to be and calm your mind maybe a little bit. But describe one other thing we can all do to be more mindful, like a basic mindfulness practice, like you were going to lead someone through something.
I'm mindful of the clock right now.
Oh yes, Christopher has to leave us at
But
1:15. So we're going to wrap up soon. So if you have a question, ask it now. If not, we can get an answer later. But yes.
This is what I call the sufficiency exercise. And you catch yourself in a moment when you think, I'm sufficient for this moment. See people walking down the street, smiling, pretty lady sitting around me. This is a good enough moment, I'm sufficient for the moment is sufficient for me. And if I notice it, that's a moment when I'm not feeding my adrenal glands. I'm going, oh, I'm not hitting that life is dangerous, what do I got to do next? I'm taking a break from it. I'm noticing my life is working right now. And I like to use the word sufficiency, which is even lower than a gratitude journal or those sort of things, which is, some people say, well, I'm not sure if I'm grateful for that, but the fact that the sky was clear today, that's a nice thing. It's
a very nice day today.
It might actually look like May a little bit.
Right. So quickly, if someone wants to connect with you, if you do need mental health services, the Pro Bono Mental Health Program with Spark the Change Colorado is a great resource.
Great, yeah.
Spark the Change Colorado, go to their website and you can get connected with resources like Christopher. But if someone wants to connect with your private practice, how do they get a hold of you?
probably the easiest way is through my website if you have access to the internet, which is www.whole-story.com, and phone numbers and emails and contact
Okay.
forms would be there.
Nice.
That'd be
And we'll put
simple.
that in the feed as well and on our blog at ninehealthfair.org. But I think we'll close and let you go. Thank you so much for joining us.
It was a pleasure.
Ding.
You could
Yay.
say